I'll tell you another case. This is case of a nephropathy, IgA nephropathy. I saw this case about 3 years back in a place called as Virar in Mumbai. And one of my colleagues used to be there, Dr. Alpesh. He's right now the head of MAC repertory in India. So at that point, we used to have our case discussions where I used to go there once a month to do some difficult cases. So he had brought a case of this nephropathy. So the 40-year-old man, he was a very popular, like a guru, saint kind of a person in very famous like Ramakrishna mission over there. Some kind of Hare Rama, Hare Krishna kind of a mission. And what was the situation was when he had come to see us, that his urine, due to nephropathy and later on there was a block, his bladder sphincter used to go into spasm. You understand what I mean? And like for whole day he was not able to pass urine. Many days like that. The urine cannot pass. And that would cause a lot of pain at night. Because imagine the urine used to get retention. And urine cannot pass. So he had to constantly catheterize. He had to go to a hospital. Frequent hospital admission was needed due to it. So I'm showing you these cases. In reality, these cases were quite long. I took about half an hour to 1 hour for the case. But I'm telling you the case in short, just the important aspects, so that you understand how we analyze and how we basically convert the patient's language into rubrics. So this local symptoms, right? Urine retention, all this. So I wanted to know what is behind it, because he was a very interesting fellow. He wore this very religious clothes, and he came with lot of his religious books, and there was something about him. So I asked him, tell me about yourself. He said, Doctor, I am big devotee of Lord. Everything is God. You should also join our. I said, okay, no problem. So if I let him talk for next half an hour, he'll keep on talking about God. Are you understanding? So in such kind of cases, now you cannot take religious affection straight away. What you should do in this case is this. What I learned. This is what I learned from Shankaran sir. He taught me this. What kind of mind rubrics to use. So we need to know the person's state before he started this. Before he went into this kind of religious phenomena. Are you understanding? What made him go over there? What was his state before it? Because that is his original state. This is all modified. Are you understanding? Patients will come and tell you, Doctor, I do meditation. Doctor, I do yoga. I forget everything. He said, okay, tell me your state before yoga. That will give you individual symptoms. This is the secret. Even in psychiatric case, patient will tell you, I schizophrenia, koi bula raha hai. Someone is telling something. No. Tell me your state, nature, temperament, emotions before this started. That is the original state. So I asked him. So he told me that, Doctor, I was very different previously. I said, what do you mean? He said, Doctor, I have done so many sins I can't tell you. So many sins. I said, what do you mean? He said, Doctor, I used to go to watch all kinds of movies. I can't tell you what kind of movies. But I used to go. I used to do a lot of, my mother used to be there, father used to be there. I used to take money from them, from purse. No one used to come to know. I used to take it. I said, tell more about your nature previously. He said, I used to watch porn movies the whole day. My mind used to be all about this. I said, okay. He said, I was a vagabond. I said, what do you mean? He said, I had so many girlfriends in my college time. Every single day another girlfriend. And then he closes his eyes and he tells me, but now you see, now I'm sant. Now no girlfriend. Only God friend, he says. Are you understanding? I say, okay, tell me a little bit about what happened. He said, I can't, I can't tell you. What happened. I said, what happened? You can tell me. See, it's all be confidential. He said, see, I don't want to say anything wrong about my religion or anything. I'm very ethical about it. See, I how I was before and then what. I said, tell me now, what do you feel? He said, no, I don't want to say anything wrong. That is the thing. I said, but why did you get into this? He said, doctor, all those things I must have done. I want to remove all that sins from my mind. I said, okay. So what is your problem? He said, doctor, all the things that we have done in past, then we have to go up and then we have to give answer. What will happen to our soul? I said, okay. Tell me a little bit more about your nature and how you are. He says, see, doctor, even previously, I'm a very fast-paced person. I say, what do you mean? He said, no, for example, I've come to meet you. I have so many things to do. I'm going to meet you, then I'm going to go to the allopath. Then I have to go to the temple. I have to take the books from there. Then again I have to go back, eat some food, get my relative from the station, from Virat station. So I have to do all these things fast. For me, it is very important to do things fast. And all the things at one time. Fast. Zzz. I said, okay, tell more. He said, but doctor, sometimes now, I am now into all this Lord and all this thing. But sometimes these thoughts come back of that vagabond nature. Because this college, junior college where I was in, that is very close to my temple. So when I go from temple, I look at the college and I remember all those days. So I go there. But then suddenly I look at the temple and then I think, no. This is... But then I think, vagabond, all those things, girlfriend, all. Then I think, no, I shouldn't do anything wrong. Are you with me? This was the major case. I mean, he went on for about 1 hour. We did this case together, me and one of my colleagues, Dr. Alpesh. So, how do we understand this? Tell me. It's very simple. So, yeah. So one of the major symptoms that he has is what? Tell me. Yes, very good. So he has kind of tooth wills. Can you understand? One thing is he keeps on thinking about sex. This, that, this will happen, that will happen. Girlfriend, vagabond. And another thing is no, temple. Can you see that? So this is kind of an alternating state. So the rubric is, how do you take temple in repertory? Religious. So you have to take religious. Can you see that? And then alternating with... Can you see this, everyone? Straight. Religious state alternating with... What is another rubric for him? Is that he wants to do everything very fast. And how many things he wants to do fast? One thing or many? So hurry. Yes? And then you have to go down and you have to study what kind of hurriness is it? Is it hurry in eating, hurry in drinking? This is how you study every single rubric. And what you'll find is that you'll see a very, very interesting rubric here. That he wants to do what? Several things at one time. Can you all see that? He wants to do many, many things fast at one time. Hurry to do several things at one time. Right? And another very important thing is that, yes, he is thinking what will happen to his life ahead. What will happen to his soul? So, anxiety, salvation about what will happen to his soul, like this. And when you take this, what is the remedy that comes? Lilium Tig. So I started reading Lilium Tig. And when I opened Lilium Tig, I found a very interesting thing. When I asked him about the religion, what happens, why don't you tell me? He said, I will not say. I don't want to say anything wrong. You remember? So I opened the rubric. You can see here, fear. And then can see it in the Kent repertory in the mind section. Fear. There is a very interesting rubric. Have a look here. Fear, say something wrong lest he should. And it has only one remedy. Fear that he will say something wrong. This is only one remedy. Lilium tick. You can take suspicious. But this is the major symptom. These are the main symptoms of the case. It is more than suspicion of fear that I shouldn't say something wrong or what will happen to my soul. It's a whole pattern. It is very important to know which rubrics to choose. If you take another rubric, you will go somewhere else. Very careful, but very, very artistically. Sorry? You can take, but it should have lilium tick in it. No. See, what you have to do now is you have to look at this whole thing, the case, the symptoms, and then check after repertorization where remedy comes. And then what you should do, you should check the materia medica also. So what I did after that, I checked the materia medica, Phatak. And when I opened Phatak, very interesting that you will see a very, very interesting symptom here in the mind section. That what is the first word written? So I knew that this person is very, very hurried. Yes. And then I see something very interesting again written here. Can you see this? Sexual excitement alternating with apprehension of religious ideas. So exact, so sharp. Means exactly what patient is saying, exact you'll find in the book. If you get that sharpness na, you don't have to worry about rest of the story. So I gave him lilium tick. And just after 2 months, he was much, much better, about 70% better. And he was able to pass urine. He now doesn't require catheter. He had nephropathy also. His creats and protein in the urine test have gone high. So it has totally reduced. In fact, recently, this was about 3 years back. Recently, I even met Alpesh and he's following up with Alpesh. He's so much better now. And there are now many, many patients from the religious temple that he sends there. In fact, about 6 months back, we had arranged a camp in Virar. 6 months or about 1 year. And there were so many patients he had sent over there. So it is word by mouth that homeopathy spreads. I'll tell you one more case and